Picture a mud brick courtyard wrapped in the twilight of 600 BCE in the ancient city of Kashi. On a low table lies a man gasping through a bloody cloth where his nose used to be, the victim of a legal mutilation. Over him stands a healer named Sushruta. If you suffered a traumatic injury in almost any other civilization at this time, your medical treatment was essentially a ritual, a prayer, or a guess. Sushruta ignores the spirits. Instead, he hands his patient a potent draught of heavy wine and cannabis extract to dull the coming agony, and reaches for steel. He selects from an array of glittering, razor-sharp blades. Some are shaped like the jaws of lions for heavy extractions, while others taper into needles so fine they can split a single human hair down the middle. Sushruta meticulously catalogs these instruments, along with 1,100 distinct illnesses and 700 medicinal plants, inside a massive medical encyclopedia called the Sushruta Samhita. He used this text to map the complete human skeletal structure and major internal organs with breathtaking precision. By documenting the body in such painstaking detail, he moved medicine past superstition. He treated the human anatomy as a complex biological machine, one that a skilled craftsman could physically engineer and repair. Look at the mechanics of the Indian flap rhinoplasty. To rebuild a missing nose, Sushruta first measures the wound with a fresh leaf. Then, using his scalpel, he makes a measured surgical incision to peel a flap of healthy skin directly from the patient's forehead. He leaves a narrow bridge of flesh securely attached at the root of the nose. By keeping this living pedicle intact, he ensures the tissue continues to drink blood from its original source. He then twists the flap completely upside down, draping it over the open nasal cavity. To ensure the patient can breathe, he props the new nostrils open using two smooth, hollow reeds. Because this technique accounts for sustained blood flow, it remains the direct ancestor of modern reconstructive plastic surgery. His precision extended far deeper than external repairs. For a patient blind with cataracts, he would take a highly specialized curved needle and gently pierce the eye, floating the cloudy, opaque lens away from the pupil to instantly restore their vision. This diagram illustrates his surgical path for an even more dangerous operation, extracting bladder stones. He mapped the route through the pelvic floor to explicitly bypass major internal arteries, navigating tight spatial constraints to remove the stones without causing fatal internal bleeding. Opening the internal cavity created a massive post-operative problem. Delicate internal tissues, like punctured intestines, could not be sewn shut with heavy traditional threads, which would tear the flesh or introduce rot. Sushruta reached for giant black jungle ants. He held them over the incision until their powerful mandibles snapped shut, clamping the flesh completely together. He then snipped the ant's body away, leaving the organic jaws behind as sterile staples that would naturally dissolve once the tissue healed. To fight off the invisible threat of infection, he ordered the operating theater to be fumigated with thick smoke from white mustard and aromatic resins. He then washed wounds in botanical antiseptics made from neem and turmeric. By combining dissolving organic sutures and natural sterilization, Sushruta successfully engineered a sterile surgical field 2 millennia before the discovery of germ theory. Teaching these complex procedures required navigating a major cultural hurdle. In ancient Kashi, strict societal taboos heavily restricted the physical dissection of human corpses. To build muscle memory without dissecting human subjects, students practiced executing long, perfectly uniform incisions, slicing into hollow cucumbers, carefully pulling wooden pins out of soft wood, covered in dense layers of cloth. Through thousands of hours of rigorous practical training, a student's hands became unshakable long before they ever touched a living patient. Look at the sterile layout, the focused central bed, and the highly instrumented environment of a modern operating room today. The blueprint for this level of medical survival was forged 2,600 years ago by an ancient mind who decided to conquer human suffering systematically.